This is Dr. Saad in front of you, and today my topic is the medical management of the peptic ulcer disease, that is the PUD. Basically, we have discussed in our special pathology lectures about the PUD, that is the ulceration anywhere in the GIT, that is the peptic ulcer disease, and the most common sites are the duodenum and the stomach. Clear? Now as we are going to discuss the management, so we will be discussing in a patient oriented way. Like if the patient is coming to you, what he will present to you is the clinical feature, what the questions you have to ask to rule out the cause, that will be the causes of that disease, and then we will move on towards the means management, that will be the investigation and the treatment. So this would be our way of doing the management. So first of all, the patient is coming to you, so what he would be presenting, that what will be the clinical features of that patient in the peptic ulcer disease. So the patient will complain the epigastric pain. This pain may radiate towards the backward. Clear? Now after this, you have to ask the patient that this pain is means relieved or aggravated. So when you will ask that after eating meal, if he says or the patient says that after taking the meal my pain is aggravated, immediately after taking the meal, it means that it is the gastric ulcer. It is due to the gastric ulcer. And if you have asked the patient that is there a pain is aggravated after eating the meal, he says no, my pain is relieved after eating the meal, but it is aggravated 1 to 3 hours after the meal. So after eating meal the pain is relieved, so that is the duodenal ulcer. This is the diagnosis, how you clinically differentiate between the gastric and the duodenal ulcer. That is, if the patient is saying that I am having pain immediately after taking the meal, that is the something gastric problem is there, that may be the gastric ulcer. If the patient is saying that I am having the pain not immediately after the meal but 1 to 3 hours after the meal, that would be the duodenal ulcer, means pain 1 to 3 hours after meal. Clear? So that would be the duodenal ulcer. Now you have asked this question. Now moving on towards the causes of this disease, means now you have to rule out the causes of the disease by asking the patient certain questions. Means that you have to ask the patient if he is taking NSAIDs for longer time, if he is using the NSAIDs for chronic disease for a longer time, then if he is taking aspirin for longer time, then you have to ask the patient about the smoking, about alcohol, and the most important factor, that is the H. pylori, that you have to means exclude this cause also. So these are also the causes, most important causes. Also NSAID is also one of the cause, but H. pylori is also one of the major cause. So you have to rule out these causes. So these are the causes of the peptic ulcer disease, and the questions you have to ask regarding these causes, that the patient is taking NSAIDs, aspirin, or he is smoking chronically, or he is taking alcohol, or he is having the H. pylori. Clear? This was just a brief review, you can say, that if the patient is coming to you, so how you will approach to the patient. Now we are moving on towards our main purpose, that is the management. Now you have in the management we have basically two things, one is the investigation and one is the treatment. So first of all, what are the investigations that you are going to carrying out in this patient? So basically there are two types of the investigations. There are two types of the investigations. One are the non-invasive investigations, and one are the invasive investigations. Clear? First of all, we are moving on with the non-invasive investigations. These investigations, basically there are three non-invasive investigations. First one is simply the serology. This serology, basically it indicates the presence of infection or not. Means if it is negative, so there is no infection, infection is excluded. If it is positive, so the infection is there. But the disadvantage of this serology is that it cannot differentiate between the current and the previous infection. So we cannot differentiate the current and the previous infection from the serology. Now to differentiate this, we have another two tests that are present, that is the urea breath test and we have the fecal antigen test. These are the non-invasive tests. Clear? So these two tests, urea breath test and the fecal antigen test, these are only and only positive in the active infection. When there would be active infection, these two tests would be positive, that is the urea breath test and the fecal antigen test, they would be positive. Clear? So these are the non-invasive tests. Now we are moving on towards our invasive test. In invasive test, one of the most important, that is the investigation of the choice, that is the endoscopic biopsy. Remember this thing, first invasive test, that is the endoscopic biopsy. This endoscopic biopsy is very important and I am writing here, this is the investigation of choice. Remember this thing. This is asked in your paper that in the peptic ulcer disease, what is the investigation of choice? So that is the endoscopic biopsy, that is the investigation of choice. And this endoscopic biopsy is very necessary to perform in every patient of the PUD. Why? Why this is necessary to perform in every patient? Because this is to rule out the malignancy. Means endoscopic biopsy is done and this will be ruling out the malignancy. If there would be malignancy present, it will be seen in the endoscopic biopsy. That's why it is also the investigation of choice. So you have done the endoscopic biopsy. Then the second test, invasive test, that is the urease test. Urease test, this is also invasive test in which we you can say take out the urea, you can say biopsy is taken from the gastric mucosa so this is also an invasive test in which we are testing the presence of urease. If the urease is found in the gastric mucosa, it means that the H. pylori is present. Clear? It means the H. pylori is present in that patient. So this urease test is positive, it means H. pylori is present because H. pylori produces the urease enzyme. Then the third one is the microbiological culture. Microbiological culture. This is also the test that tells you specific about the infection, any infection that is there, like the H. pylori, all that. So these are the basic three investigations, and in this way we have completed the investigations. These are non-invasive investigation and the invasive investigations. Non-invasive, we have the serology, the urea breath test and the fecal antigen test. The invasive one is the endoscopic biopsy, urease test and the microbiological culture. Clear? Now we are moving on towards the treatment option, that is the very important part of this peptic ulcer disease, that medical management. Surgical management we will be doing in the surgical lectures, but now we are doing the medical management. So first of all, you have to see one thing, that you have to exclude. For example, you have done the investigations and now it is proved that the H. pylori infection is present. Clear? If now medical management will be based upon this H. pylori. If H. pylori infection is positive, if this is positive, then you have to do a therapy that is called as the irradiation therapy. Eradication therapy or irradiation therapy means you have to eradicate this H. pylori. So this therapy is known as the irradiation therapy. Now in this, what you are doing, this is basically consists of the two regimes that are present. One regime is the triple therapy and the other one is the quadruple. First of all, we are studying the triple therapy. Basically, this irradiation therapy consists of one PPI, that is the antacids, and two antibiotics. Clear? So in the triple therapy also we have the one PPI and the two antibiotics. Now what is this triple therapy? Which type of the drugs we are going to give in this therapy? See, first of all we have the omeprazole. This is very common drug. You all know this is a PPI, we are using it, that is 20 milligram of the omeprazole. Then along with this you are going to give the clarithromycin. Mycin. This is, I told you that this is a antibiotic, and this is about 500 milligram. Then the third one that you are going to give is the amoxicillin, that is 1 gram amoxicillin. This is basically the triple therapy: omeprazole, clarithromycin, amoxicillin. And how much? All these three drugs, they are given twice a day. Means 2 times a day you have to give these all drugs 2 times a day. And for how much days? This is about 14 days. For 14 days you have to give this therapy for the 14 days. Now second triple therapy, if you are not going to give this combination, you can give another combination also, like omeprazole, same 20 milligram, clarithromycin, same 500 mg, but here you may give metronidazole. This is also an antibiotic, and that is 400 milligram metronidazole. These all the drugs are given twice a day. Clear? So this is another triple therapy that you are going to give in the peptic ulcer disease. Clear? Omeprazole plus clarithromycin. This is very important medical management of PUD. Clarithromycin plus amoxicillin, and the dosage must be remembered: 20 milligram, 500 milligram, and the 1 gram of the amoxicillin. Then same triple therapy: omeprazole, clarithromycin, and the metronidazole 400 milligram twice a day for 14 days. Now another therapy, we have the quadruple therapy. Investigations are done. Okay, now we are moving to the quadruple therapy. Quadruple therapy, first of all, when this quadruple therapy is given. For example, if the patient is not responding to the triple therapy, if this triple therapy fails, if the patient is not responding to this triple therapy, or if the patient is resistant to this clarithromycin, so you are going to give the quadruple therapy in those cases. Now what is quadruple therapy? Obviously quadruple means 4 drugs. First of all is your bismuth chelate, or substrates you can say, that is 120 milligram of the bismuth, and it is given 4 times per day. Number 1 drug. Then number 2 drug, along with this, with the bismuth, then you are going to give the metronidazole, and that is same 400 milligram as here mentioned, 400 milligram, but now here it is 3 times per day. This is second drug. Then the third one, we have here the tetracycline. Tetracycline here was clarithromycin. Now the tetracycline has replaced this clarithromycin because the patient is resistant to this, or the patient is not responding to this therapy, then we are giving this therapy. Now tetracycline, once again 500 milligram, and it is given 4 times per day. This is your third drug. And the fourth and the last one is very important, is your PPIs. That may be omeprazole or any prazole that is given, that is the PPI. It may be 20 to 40 milligram of the PPI, and this is also this is given, I guess it is 2 times per day. So this is your quadruple therapy, in which we are giving the bismuth chelate, that is 120 milligram, and we are giving metronidazole 400 milligram, then the tetracycline and the PPIs, that is given 20 to 40 milligram 2 times a day. This how much times it is given, this is also very important to remember. The dosage of these drugs, this is also very important to remember, and these drugs names, they are also very important to remember, because in the medical management this management is very important. So this is the quadruple therapy is given when the triple therapy fails, or the patient is not responding to the or resistant to the clarithromycin. Now what happens if the quadruple therapy also fails? Means if this therapy, it is also failed in the patient, and this therapy is also given for further 14 days. If this therapy is also failed, Then you will be carrying out the antimicrobial culture. Obviously we are going to confirm the diagnosis that why this therapy is not working. If the H. pylori is positive, then what's the problem is there. You will further carry out the investigation, further you will carry out the antimicrobial cultures is done, sensitivity is done, and then you will give another therapy that is called as the rescue therapy. It is very rare, in very rare cases it occur, but it occurs. That's why I have to tell you that rescue therapy is levofloxacin. Then we have the clarithromycin, and we have the PPIs. So this is the rescue therapy. In certain cases, in very rare cases, if the quadruple therapy fails, then you have to give the rescue therapy in those cases. So this is the medical management. If the H. pylori infection is positive, then you are going to give the irradiation therapy. Second is that if the H. pylori is not positive, if the H. pylori is not positive, the H. pylori is negative, if I am writing it here, H. pylori is negative, then you will only give the acid suppression therapy, called as the acid suppression therapy. Acid suppression therapy is simple. You will give the PPIs to the patient. Simply you are going to remove the cause. Like if the patient is taking NSAIDs or aspirin, then you will decrease or you will stop NSAIDs or aspirin. You will ask the patient to stop smoking, ask the patient to not take the alcohols. So whatever the causes are, you are going to remove those causes in the patient. Clear? So if the H. pylori is negative, you are going to give simple acid suppression therapy, that is the PPIs, and the NSAIDs must be stopped, smoking must be stopped, and whatever the cause is there, you have to stop that cause. So this is about the medical management of this peptic ulcer disease. Now in which cases you are going to give the irradiation therapy, like it may be H. pylori infection, it may be the gastric carcinomas, and it may be in the patient who is having the history of the gastric cancers may be there. So they are certain in the chronic use of the NSAIDs, the irradiation therapy is given in those cases. Clear? So these are certain cases that are given, and in those cases where the irradiation therapy are not given, that are the GERD, in the gastroesophageal reflux disease, you are not going to give this therapy. And in the patients, in the asymptomatic patients with the no risk of the gastric cancer and no familial history of the gastric cancer, in those patients you are also not going to give this irradiation therapy. So basically main use of this irradiation therapy is in the H. pylori infection. So anything that is remaining in this, I think so this I have completed almost all about the medical treatment of this H. pylori. And so this is all about the medical management of the peptic ulcer disease. If you have any query, any confusion, you can ask in the comment section. Thank you so much. Allah Hafiz.